Hi everybody, it's Andrea, and I just wanted to do a quick update from my last video. I did go and see the other neurologist who is doing the comparison study of Botox, Dysport, and the other one is like Neosum, and they're all basically the same type of drug. They all do the same thing. And what the study is, it's really a registry, and what they're doing is comparing the effectiveness and how long the effects last, if they work for you. So, you know, comparing like Botox to Dysport, which one has the longer lasting effects, because the injection can only be done every 3 months. So they're trying to find a study that I can get in for this registry. She did do an exam on me, and I now have an answer to what this pain I've been living with and complaining about for close to 5 years. They were looking back at my medical records, and I've been complaining about this forever. And it was one of the things I just assumed it was a precursor to the MS. But before I was diagnosed, I had problems with holding my head up, especially when driving. I would be driving to work, and I would have this sensation of being pulled back, and I would have to put my seat up so I could rest my head on the headrest, and I still have to do that to this day. Basically, what she found is I have cervical dystonia, and it's a more focal dystonia, basically meaning it's affecting just pretty much one area localized, and that is the base of my skull and my neck all the way down into my shoulders and my collarbone. And I'm lucky I have a mild form of it. I've been doing research, and I have one of the lesser prevalent types. The most common ones you'll see if you look it up on the internet is the people who are twisted to one side and they're like bent over. I can't bend my neck that way. It's really giving me a hard time today. But she even asked, "You've been complaining about this for years and nothing's been done." I'm like, well, everybody just chalked it up to my MS, I guess. I've tried drugs, none of them have ever touched it. Muscle relaxers, you know, things for spasticity, and those things work for anything from the waist down. Nothing touches this. I mean, hardcore muscle relaxers and make my legs and everything all wobbly, but nothing touches the neck. I've done physical therapy for my neck. Nothing touched it. So now I have a name for the pain. So it was a relief to finally figure this out, because not knowing and having it being a 24/7 thing that I never get a break from. So now we're going through to see some of the different registry trials to see if I qualify for any of those. Some of them have exclusions because I have MS, or people who have underlying conditions that can exacerbate the dystonia. They want to exclude, but I think it is the Neosum one I think if you go on Gov Trials, you know, where you can look at all the drug trials, I think it's called Excitable. Interesting name for it. But I am trying to go forward and have them submit this to my insurance to see if I can get it approved, and then I'll have to see what the copay is. Since it is an injectable, I'm concerned that it would be what the copay is for if I were on one of the DMD drugs. My copay would be $250 a month, and that's just more than I can afford right now. But I'll cross that road when I come to it. But I just wanted to give everybody a quick update and let you know there is a name for the pain. So I hope you all have a wonderful Christmas. There's only 5 days left. And I'll be talking to you after the new year. So Merry Christmas, Happy Hanukkah, Happy Kwanzaa, and anything else that I might have forgot. Okay, bye-bye, signing out for now.